We're going to talk about lifting and moving patients. In recent years, there's been a lot of tools that have been brought to the market to assist you with lifting and moving patients. However, at the foundation, it's still a very physical thing to do. And the key is to lift and move patients in a manner that is safe for you and safe for the patient. And the reason that it needs to be safe for you is because it is some of these times when you're going to be lifting and moving patients can be career-ending injuries. So it is very important that you lift and move them correctly and learn the correct body mechanics. So in this section, we're going to see a lot of different videos from, for example, Furno that makes cots. They had a video series several years ago where they went through safe lifting techniques, and we'll see some other videos as well. So some of the tools that you'll see for patient movement are, of course, the wheeled ambulance stretcher. There are manual versions as well as more automated versions. At our agency, we have both of them, and so you'll get experience with both of those and proper lifting techniques as well. There's the backboard. In recent years, the backboard has been de-emphasized some. The original purpose many years ago of backboards was to move patients from one area to another, and then the secondary purpose of those were for spinal immobilization. So we'll talk about some of the changes in spinal immobilization when we get to head, neck, spinal injuries. But at this point, the backboard is for moving patients from point A to point B. And then we've got the stair chair. There's a variety of types of stair chairs out there. They are becoming easier to use. However, again, just like everything else, it is very physical to move patients downstairs or across rough terrain. And then there's the scoop stretcher, and this particular picture shows an aluminum scoop stretcher. However, there are plastic made scoop stretchers out there as well, similar material as to the backboards. The scoop stretchers typically aren't used a lot. However, they have some very good uses when they're for patients such as hip fractures, where it's very painful to move patients, log roll them from side to side. But scoop stretchers have their place, and they're just another tool that we would use. As I mentioned earlier, body mechanics is very important. This can not only save your career, but also save the patient from injury. And we know we have a very litigious society, and any time a patient would be injured, you can expect some sort of lawsuit for that, as if they can prove that we dropped the patient or we moved them in some way that was unsafe. So it is important to use proper body mechanics anytime we are lifting. If we use improper body mechanics, we risk hurting our patients and ourselves. Some statistics from the CDC from 2017 show that there are more than 21,000 injuries annually from poor body mechanics. 61% of those are injured that are injured are under the age of 35, which gets into a big portion of our EMS age segment. And 32% of the injuries involve the neck, shoulder, back, and trunk. Again, with certain types of injuries, they can be career-ending type of injuries.
There are right and wrong ways to lift, move, push, pull, and carry heavy objects. And in EMS, it's all about equipment and patience. In a perfect world, you would always lift the right way, but sometimes patient position, space, terrain, and other hazards make this difficult. To minimize risk in these situations, utilize all of the tools and techniques at your disposal to avoid injury and make your job easier. Your body is the ultimate tool that you have, and in order to make the best use of adjuncts like cots, backboards, and other equipment, you need to have the ability to use yourself to your full advantage. To use your body in the most efficient manner and reduce strain on your body and the risk of injury, there are 3 very simple and incredible tricks that you can use to increase your biomechanical efficiency and make your patient handling tools even more effective. These tricks are, number 1, rooting the floor. Number 2 is the hip hinge. And number 3 is a neutral spine lifting posture. Rooting the floor. Sounds kind of funny, and it's hard to root your mind around. But this is a great trick when you're lifting any heavy object or when you're stepping up into the truck. When preparing to lift a spine board or stretcher from the ground, place your feet in a slightly wider than shoulder width kind of a distance and root your feet to the floor. Visualize gluing your entire bare foot to the floor or making a perfect footprint in some freshly poured concrete. Putting your body into this ready position will make any lift you do safer, and it increases your mechanical efficiency. Rooting stops you from lifting off the toes and helps you maintain a flat back posture during any lifting movement. This technique increases your balance and makes your gluteal muscles fire properly, relieving your back of additional strain. The hip hinge, step number 2, places your spine and pelvis in the optimal position for transferring or lifting. This is really the correct way to perform a squat and a bend at the hips. A good bend is initiated at the hip and not the lower back or knees. You literally hinge yourself at your hips. Those who don't perform this movement tend to favor bending through their backs and are predisposed to developing low back pain and poor performance. Neutral spine lifting posture involves following 2 steps that place your torso and upper body in optimal lifting position. Head up and shoulders back. If your head is up, your back is always in a safe position. Never look down during a lift or a transfer. Keep your eyes up and straight ahead at all times. When performing a 2-man lift with a stretcher or spine board, it always helps to look your partner directly in the eye. This keeps your head up, reminds you to maintain good body mechanics, and helps communication during the lift. Keeping your shoulders back when you perform any physical task. This is the best way to transfer the forces of an exterior load from your extremities into your core, such as when you lift a patient on a spine board. Simply keeping your shoulder blades in mid-back pulled slightly down and back accomplishes this task. Think no shrugs. Keep your head up, and you are well on your way to staying injury-free. Let's talk about the anatomy of an injury. In public safety, most injuries, and often the most debilitating and expensive injuries, are categorized as overexertion.
An overexertion injury occurs when soft tissues, such as the muscles, tendons, and discs, are so profoundly fatigued from poor posture and repetitive patterns that they simply fail to perform seemingly normal tasks. We rarely get hurt moving the obese patient because we are totally prepared for the movement. We tend to get hurt doing seemingly normal tasks where you're not prepared, and then sustain an injury doing something normal like putting the monitor on the cot. To fully understand how and why this happens and to break the cycle, you need a basic understanding of the 2 common postural distortions that allow these injuries to happen: upper cross syndrome and lower cross syndrome.
From an early age, we basically spend our lives in a very forward posture. I mean, think about it. When you go to kindergarten, you sit at a little tiny table at a little desk, and you live your life down here. Fast forward to today. You've gone to school and you're on your computer. You're turning pages in a book and you're driving. You're texting on your cell phone. And oh, by the way, you treat your patients down here. You take them to the hospital in this position. When you get done, you get right back into the ambulance in a forward posture. What happens is, because we're in that repetitive faulty posture all day long for our entire life, this very predictable cascade effect occurs. The muscles in the front of the body become short and tight. The deep neck flexors, the muscles in your pecs, and primarily the muscles of the internal rotators of the shoulders. They take the entire shoulder girdle. Shoulders drop forward, head pulls forward. We feel the symptoms posteriorly. You feel the pain in your upper back, your neck, your shoulders. But the problem is because of what's happened in the front. The best way I can give you an example of what that looks like and what it does is this. If I stand in normal neutral posture and I go into external rotation, which is a very important movement for the shoulders, this is about as normal as it gets. If I put myself into an upper crossed pattern, it shuts my normal joint movement down. So no matter how strong I am or how physically active I am, I can't get my arms into a normal, safe biomechanical position. So when I go to do something normal, like, everyday task in your job, pick up that monitor, and you go to place it up onto the stretcher, you sustain a shoulder or rotator cuff injury. It's not the monitor that caused that injury. It was the fact that your shoulder joint has lost its ability to move normally due to that upper crossed syndrome. So we feel that pain posteriorly due to that frontal issue. Neck pain, headaches, popping, clicking in the jaw, rotator cuff injuries. Muscle sprains and strains in the upper and middle back are all a result of this long-term faulty flexed posture that ultimately change how the body moves, leading to those very high injury rates that we see so common in EMS. One of the primary causes of lower back injury and knee injuries in public safety is not always the fact that our back is weak, it's the fact that our spines have become overloaded. And our spines have become overloaded due to this very predictable cascade effect that's referred to as a lower crossed syndrome. Here's what happens. We sit for long periods of time, and we're very compressed at the hip joint. The hip flexors are compressed, and a very important spine stabilizer and trunk flexor called the psoas becomes very compressed and tight. When they become compressed and tight, what they do is they take the center of gravity in the pelvis, which should be in a nice neutral spine, a safe lifting posture, and they pull everything forward. So the center of gravity shifts forward. The pelvis rotates out of position. When that happens, it inhibits the abdominal wall. Well, we all know strong abs, strong back. But what happens is, as the pelvis is pulled forward, we're not in neutral spine anymore. Abs are inhibited, not doing their job. The spine naturally becomes overloaded, and we sustain injuries doing things that should have never hurt us. So as that's going on, the body kind of wakes up, and it realizes that it's way out of position. These aren't doing their job. Way too much strain in the lower back, so it fires the hamstrings. They get tight to try to pull you back into place. So there's this tug of war going on between the front and back of the body, and ultimately the spine is caught in the middle. So as this tug of war is going on, and we're feeling more discomfort in our backs and our knees, the most important muscle group in the body, which is your hips and your gluteal muscles, become very inhibited and very weak. They sort of get confused. And when your glutes get confused or inhibited, a couple of things happen. Number one, that's where most of your power generation for lifting, pulling, pushing, or transferring a patient come from. That's where a lot of your balance comes from. But your gluteal muscles have a secondary job, which is as a hip extensor and as a hip external rotator to rotate the femur. When they don't do their job properly, normal things like going into a squat to safely pick up a patient, when you go to come up, glute doesn't fire, knees turn in, and you end up lifting with your back. Therefore, we start sustaining injuries even if we thought we were lifting properly doing things that should have never ever hurt us. And it's all this cascade effect called lower cross syndrome causing these types of injuries.